So good afternoon, everyone. Welcome to Lunch and Learn, hosted by us here at the Northwest London Collaboration of Clinical Commissioning Groups, short title. And this will be done in conjunction and in collaboration, really in partnership with the product director from In Healthcare. So my name is Kwesi Affle. I'm Digital Innovation Lead for the Northwest London Collaboration of CCGs. And I'll be doing this presentation, as I said, with Jamie Innes, from the product director from In Healthcare. So we just get started with our first slide, tell you a little bit about what's going to happen in this session for the next 30 minutes. So we're going to have a 25-minute presentation, and then we'll have 5 minutes for questions. Please do submit those questions using the chat functionality on the bottom right-hand corner. And please kindly mute your phones as well to limit the background noise. So brilliant. So we'll get going. So we're going to have a very brief introduction to Northwest London, and then we'll have an introduction to In Healthcare, our partners, and then the actual toolkit that we'll be going through today, and also a very brief demo. Hopefully the tech will work on how we actually were developing one of the solutions that we're working with the digital outpatients team, and then we'll have a session for questions. So let's go on to our first slide about Northwest London. Thank you, Jamie. So essentially, this will not be death by PowerPoint, so don't worry. So essentially, this image here is just showing the sort of activities that we have going on in Northwest London. So we have our clinicians in primary care there in the centre. And then to the left, it really is the different areas that our clinical colleagues across our 364 practices in Northwest London are doing. So we're working on a range of people that may have multiple long-term conditions, as indicated there by the medications. Then people possibly that are gravely ill and are quite isolated to their homes, or obviously need to be cared for. Them leaving their homes is not easy. And then also other accessibility issues, as we see there by the third image down. And then we have a large elderly population as well. But as we've seen very much from the other activities that my team manage, are very much digitally aware and keen to use digital. And then also a massive part of our population are families as well, with different makeups and different arrangements. And then on the right hand, we have our 6 hospitals, our 8 councils or social care, and then also our 150 plus care and residential homes. And all of these population, everyone amounts to 2.5 million people. And essentially, what has happened is that as digital has come to the fore, I've had in my role since I've started, people coming left, right, center. You know what, we've got this problem in primary care, we've got this problem in the hospital, and we want to use digital to do this. We have most recently, in the last year, been working with social care colleagues across the 8 councils as well. So there are a lot of people that want to use digital in a way to connect with patients, as you see from the left-hand side. Now, what's the most affordable way to do that? Because essentially there are so many products out there, and there's so many different ones you can commission, but obviously it's quite limited, isn't it? Now, what's very interesting is what I'm going to go on to describe in the next slide, actually, with regards to the different digital offerings that we could commission. So this is just, you're probably thinking, why has this guy got a picture of all the channels for a cable TV package? And this is just to indicate something. So if you have cable, or satellites, Sky, essentially you'll be offered different packages, won't you? And this one here is the top package on the cable provider. Now, if you have this in your home, you are not going to be able to watch every single channel. However, you can't just ask for 1 or 2 channels. So you might just think to yourself, well, you know what, I like Sci-Fi and Sky News, and that's all I want. You have to pay for something, and you'll get all of those channels, even if you don't even click or watch them at all. And that's the thing, and that's the sort of issue that we have in Northwest London. There are so many different apps that we could use, so many different apps that could be commissioned. A, don't have the money, But also B, a lot of those solutions have been created without us in co-production. Therefore, it may handle, or we may want one or two features, but there may be a whole host of other features that we're just not going to use. Therefore, is that good commissioning? And is that a good use of public funds, especially when things are tight? Well, obviously it's not, isn't it? So that's the quite clear problem. We have a digital landscape, we have the various digital tools, we have digital direction from national, we have local digital priorities, 8 CCG organizations, 8 councils, 6 hospitals, the associated mental health hospitals as well, and also a voluntary sector. So how do we do that? How do we leverage all of that? How do we leverage digital in the smartest and cleverest way, but also having interoperability as really what underpins all of that, so these organization systems can speak to each other? If you just go to the next slide. Well, again, as I was just saying, this is the issue we have. We have very little funding, funding which allows us to do core things, but when it comes to transformation digital, there isn't a lot to go around. So we've got to make clever decisions. We can't commission 6 or 7 off-the-shelf apps, which will probably bankrupt us or leave us quite stretched. Don't speak to each other in terms of connectivity, and don't speak to our clinical systems. So what's the point? What's the point commissioning something if we're only going to use 5% of what that tool is going to do? Where's the forward planning, and where really is ingenuity with that? We've just looked into our next slide. So essentially, this is what we want to do. We want to be able to leverage things like the new national app, the NHS app, which is focused on national delivery of national tools. And then we also have Health Hub Now, which is our customizable local version, if you will, of the NHS app, which allows us to develop things rapidly, allows us to work on things like the No Diabetes platform, refer people to other apps which are being led by colleagues like George Absey from the Strategy and Transformation team, and then be able to direct people to voluntary sector and getting involved in the digital social prescribing and digital patient activation measure space as well. But also then linking in with our councils. How do we leverage all of that? And then, as you see in the middle, we have people that are not digitally aware at all and literally are just using their phone predominantly for their services, to get in touch with healthcare, and they don't want to get involved with digital. And then you've got people that are a bit of in between. They may not really like to engage in a digital perspective, but also they are quite comfortable with SMS. So how can we, help these ones to obviously engage with their own health and engage more cleverly with our clinicians across the North West London Health and Care partnership? And then, as we've said in the corner, how do we bring in social care, GPs, hospitals, our care homes all together, and then be able to enable the patients, indicated by the 2 figurines there, to be able to interact in the way in which they want to and get access to their records. So that's the next, I'm not sure if the next slide is me or you, Jamie. That's right. So essentially, what we have got is that we are going to allow CCGs and our other partners in the Health and Care Partnership, or STP, to be able to come up with ideas, as is indicated at the top there, submit those ideas on a pro forma where they explain the needs, the app idea, what they'd like to do digitally, how they'd like to interact with patients, whether it's by digital, SMS, or by an automated phone service, or all 3, to the user. And then that will be sent to myself, who's indicated by that single person, which I will then take to the North West London App Board, which I have set up, which is chaired by a clinician, the Clinical Chief Information Officer from Imperial Hospital, and is largely made up of clinicians across North West London. Then if at the bottom left hand, is the hands clapping there, it's approved, then I let the teams know, the clinical team or the clinical lead, and also the organization that submitted the idea. That idea is then developed, as we see by the screen there in the cloud, doing it iteratively in an agile way, and then we deploy an app. which is obviously meeting a specific need. Now, this is all delivered by our platform, which is being managed by the in healthcare team, and it's who we've partnered with to do this. And to explain a little bit more about what this digital platform does, I'd like to now introduce you to Jamie Innes, who is literally going to go through this platform, tell you a little bit about in healthcare, and then be able to answer any questions at the end.
Perfect. Thank you very much, Kwesi, for that introduction. I think that was really valuable to understand more about the challenge that's being faced in North West London and how you can commission those types of applications across a wide scale and region. And that interesting health economic mix that you've got in that area, it's quite challenging, as you can see. So what I want to do is give a bit of background to in healthcare and a bit about where we've come from and a bit about our platform. And then what I'm going to do is move on to a live demonstration of our toolkit and walk you through an example service that we've built with North West London CCG recently and give you a live demonstration of how that works so that you can see the power of the toolkit. So first of all, I'll just give a bit of a background to in healthcare. And now in healthcare has been going now for approximately 6 years. And we've developed a digital health platform to enable the NHS to deliver more care outside of hospitals. And it's really been designed to empower patients to manage their own health. What makes in healthcare slightly different to other technology companies is that we're not tied to any particular hardware or technology solution. Instead, we work with our NHS customers to develop solutions that are specifically designed around their own local challenges and population. And a big part of what we do is ensuring that we're providing patients with choice and that we get the data into the hands of healthcare professionals by integrating with the clinical systems and the workflow that they use. Now, first of all, just to kind of go around why digital health is so important, at the NHS Expo in September, Simon Stevens stood up on the stage and said that digital health was the future for the NHS. Now, there's a few reasons why digital health is so important. And firstly, the Health Foundation recently published a study showing that some of the capacity challenges that the NHS is facing. Their study showed that 1 in 11 NHS posts are unfilled, with 2/3 of trusts recruiting clinical staff from abroad. Now, you've got an ageing workforce and future challenges in recruiting those clinical staff from abroad, resulting in a perfect storm of staff shortages. At the same time, demand for NHS services is outstripping supply, yet a common location for most clinical activity is still busy outpatient clinics. And the number of outpatient appointments has nearly doubled since 2006, rising from 63.2 million to 118.6 million in 2016-17. So even though the NHS is facing a skill shortage, poor processes mean that highly experienced clinical staff are spending time on tasks which should be automated through the use of technology. And it isn't scalable for the NHS to keep increasing funding each year to hire more staff. The NHS needs to leverage existing technologies to be able to allow its staff to be more efficient and stop them doing tasks which could be automated and allow them to spend more time with the people that need their help face to face. So now I'll just move on to a little bit about the in healthcare platform. And we've got a couple of different layers to the platform which I'll work through. So firstly is the communication layer that we have, and that's really to allow us to communicate with patients and citizens in the different environments that they find themselves in, whether that be patients in their own homes, patients on the move, or patients in care or residential homes. And I'll go through in a bit more detail very shortly around how we communicate with patients and how we provide them with choice. Once we collect that data from a patient or citizen, we bring it back into the in-healthcare platform, which is hosted within Amazon Web Services, and that's where we design specific pathways based upon our NHS customers and where we're going to take that information and maybe notify patients of outcomes. Maybe we're going to integrate that data back into different clinical systems. Maybe we're going to put that information through different rules and algorithms to determine whether we need to alert a healthcare professional to some patient and citizen and advise that they contact them. Now, within the platform, we've got various different APIs which allow us to integrate with third-party organisations. So we integrate with some leading third-party suppliers who provide us with great clinical content, or potentially have their own digital platforms where we can provide information from telecare and other different environments. But a big part of what we do is developing integration with various clinical systems that NHS organisations use. So that's GP systems such as EMIS, System 1, Vision, but also different PAS systems within secondary care. Now, just to move on to the communication channels that we have available for patients. We appreciate that not every patient is the same, which is why we want to provide them with choice and allow them to interact with their healthcare professional by the means that suits them best. And it's really interesting that Ofcom did a study fairly recently showing that the percentage of the adult population that has access to a smartphone, and it currently stands at 78%, and it's rising year on year, which is great that 78% of the adult population have access to a smartphone. But it's also important to recognise that 22%, or a fifth of the adult population, don't. And it's highly likely that this percentage of the adult population are the biggest users of NHS services. And this is why we support things like text messages and automated phone calls for patients who don't have access to the internet and don't have access to technology. Separately, we also support patients that are on the move using a smartphone app and online portal. And also we support patients residing in care homes who have an app for care home staff to be able to submit information on behalf of their residents. And finally, we've been doing work internally with Amazon Alexa, as that looks to be a promising way of patients interacting with health services in the future. And the Ofcom study in September showed that 1 in 8 households has a smart speaker, and I anticipate that number to keep rising dramatically over the next few years. But what this means for patients, especially when they're using an app, is that they have all their health conditions supported through one single application. As Kwesi pointed out earlier, it can be very difficult from a patient's perspective to know which application to use. And when you go on services like the NHS App Store, you can provide it with a long list, and patients could end up with different health apps for every single condition. Whereas what we're trying to achieve is providing patients with a common interface into the NHS, providing them with one single application which treats all of their conditions, gives them access to appointment reminders, patient leaflets, and also basic things such as medication reminders. Now, to date, on the healthcare platform, we've developed with our NHS customers over 75 different digital health pathways, and each of these pathways has been designed by an NHS organisation and their clinicians, and it's designed to solve a real NHS problem. We haven't designed the technology and tried to find a home for it. We've always started with the problem that we're trying to fix. And as you can see from the examples in the list, the platform's been used across many different disease areas and challenges, from simple medication reminders to cancer tracking pathways within the acute hospitals. Now, to move on to the In Healthcare Toolkit, when we started developing digital health services with our customers, we realised that co-design was a significant part of the process of building a service. It enables healthcare professionals to feed back on the service and have a say on how it should work. And what we developed with the In Healthcare Toolkit was a capability to be able to allow NHS customers and their clinical teams to develop digital health services at scale and at pace and at low cost. And you can imagine the toolkit is like a set of Lego bricks, enabling you to reuse components to speed up the process of building. And the idea is that if you don't like that service or you have feedback, you can quickly make tweaks and changes based upon what patients and what healthcare professionals receive through that service. And what the toolkit allows is for best practice to be shared across the NHS, and we've got some great examples of how NHS customers are using it to deploy digital health services across the region. Now, before I go into the live demonstration, I've got a short video here just quickly showing the toolkit in action. And you can see from the video that the toolkit is based on a very user-friendly and intuitive kind of drag and drop interface, although people can change that if they want to, so it allows technical and non-technical people to interact with the toolkit and design a pathway. And what we're able to do is design these processes very quickly with users in the room so that we can get information and feedback on how a pathway should work or how a form should be displayed to a patient. And it allows for that instant feedback. And you can see that the toolkit in the background is generating the code that's going to be used on the InHealthcare platform. Now what I'm going to do is move across to a live demonstration of the toolkit so that I can show you how it's being used to create a dermatology service within North West London. So what you should be able to see now is the InHealthcare toolkit. Now it's a web-based development environment which allows us to generate these services very quickly and easily within the NHS, and here is an example of some requirements that we got provided for a dermatology service that we're developing with primary care. And the idea behind the service is that it will provide GPs with the ability to take images safely and securely for patients with skin conditions so that they can be put back into their clinical system and passed on to the relevant dermatologist. Now, if I enter the project workspace now, it will open up and load in to the project that I've created. Now, at the moment, it's a blank project, it's completely brand new. So what I want to be able to do is I want to be able to add in a form. So I want to be able to create a form of how this is going to look to the end user when they use the InHealthcare application. So what I'm going to do is add a web questionnaire, and I'm going to call it a dermatology assessment. And what you can do with the InHealthcare toolkit is very quickly and easily build up a service using the interactions and these user menus which allow you to design these forms. So I can build up a web questionnaire, and we can see it taking place on the right hand side, and we can see it building up at the same time that I'm typing this information in. So I want to start and build this form for my smartphone application, and I can start to build this information straight away. And the first step that I want to add in is patient consent. And you can see my poor typing skills. Now what's quite useful is that the toolkit has a built-in spell checker, which I find very useful because I make a lot of spelling mistakes. But what we can do is build this form in real time with a user. And we can start to build in logic that will mean that when I answer certain questions, only others will appear. So I want to now add in a question around consent, and if the individual consents to information being shared as part of a research questionnaire. So I add in this question, and I can see that it will appear straight away. And now what I want to do is add in some logic that will mean that that will only show at certain times. So I only want it to show if the patient consent has been completed. And I can say I want it to be required if it's visible, or I can make it optional. And this is all very simple and easy to create in the toolkit so that we can build in this logic of this form. Now I might also want to be able to put in some information around whether this application can only be used for certain patients. So I'm going to add this in now. And I can build in this information, and then we can make that information bold as well, because it's quite important information. And what you can see on this right hand side is exactly how the form is going to be displayed to the end user. So it's a great way of getting instant feedback from a user in a session as to how they want the form to work, how they want it to look to the patient. And you can see as well the logic that I've built up is meaning that only certain bits of information will be displayed to that end user when they've processed certain parts. So it means that you can have very interactive sessions with healthcare professionals and patients in the room, getting them all to design these digital health services, providing instant feedback. So I'm just going to add in some other options here where the individual will be choosing the skin condition that they're going to be taking an image of. And you can see that as I'm typing these bits in, it's starting to appear on the right hand side. And we can add in some more options as well. And as you can see, it's very simple for you to add this into the form. It's very simple to build, and it's very quick to learn as well. You don't have to be very technical to be able to use this. You learn very quickly and easily how the solution works. And it's all based on these options which will appear, which will guide you through what's available at certain times. And we can start to see as well, this form is starting to take shape. Now, to save a little bit of time, I'm just going to quickly paste in some additional information that I've got pre-prepared around how we want the form to work in the event that somebody is got a rash or a single lesion. We can see here if they've got a rash, I want them to choose the location. So I want them to say where it's located, and we build in the logic which says if it's on certain parts of the body, then we want to ask other questions, and we can build this into the form very quickly and easily. Now what I want to be able to do is be able to take images on the smartphone app, and that's so that I can take them very safely and securely and transfer them back into the GP record. So what I'm going to do is just take out some information here, and I'm going to add in that this will allow me to take an image, and we're going to use the camera device on the application to get that image, and I'm going to label this image 1. And as you can see, it's not available on the toolkit for me to test, but once we deploy this to the in-healthcare application, we'll be able to test that and see how it works. And we want to be able to upload that back into System 1 as well, so we can add that capability in. And what that means is when I take that image, it will create the necessary attachment or read code for me to upload that back into System 1. And you can see very quickly and easily I've built a form which I can then walk through with patients, walk through with healthcare professionals, get feedback, instantly make those tweaks and changes. And what it means is that you can reduce the amount of time that it takes to develop these digital health services. It means that there's a rapid iteration process, and that it's very quick and easy to do that co-design process, rather than spending weeks and months, taking back requirements and taking it back and forth between development teams and customers. You're able to get people in the room together, designing and working on that service. Now all I need to do then is add in some bits of information into the service flow, which is really the brains as to how the pathway works within the platform. Within the service flow, this is how we'll define how the communication will work with patients and healthcare professionals, what we do with the information when it returns, and where the information will be integrated into other clinical systems. Now the service flow can be very complicated. It can add in rules and algorithms and triggers of what will happen with the information when it's received. But the service flow that I'm going to be creating here is actually very simple, because all I want to do is ask somebody to complete a form and for that information to be submitted. So what I'm going to do here is just start to add in some bits of information. Yeah, and we're starting to add in some bits of information now. And you can see that the form will start to build itself. We can start to build this pathway up, and we can use the drag and drop interface as well, so we can start to build up this process. Now it's very simple and easy, this one, but you can imagine these pathways can be very complicated. You might have different rules which mean that the pathway starts to branch off based upon logic and based upon the information that's sent in. Now what I want to be able to do is quickly deploy that dermatology service, and very handily I've done one previously, so I'm just going to take that same name and I'm just going to change the date. And I can deploy that to the in-healthcare portal. So we can now see how that's going to work. Now I've got this set up within System 1, which I'm now going to bring into the screen so that we can see how this application will look. So I'm within a patient's record now within System 1, and what we've got configured is these little buttons here, which are going to launch an in-healthcare application and pass across some patient demographics. So once I press that button there, we can see that it has launched the in-healthcare application. It's automatically logged me in, and it's opened the patient record that I wanted to work in. And what that's done is that's referred the patient onto the in-healthcare system. Now, what I'm going to do here is show you the in-healthcare application that we use for healthcare professionals, so that we can see how that form that I've just created works. You can see there that it's loaded in the patient. So we can see Jamie Innes has been referred onto this service, and we can see some of the bits of information that I've put in there. We can now go through different parts. I want to go through and say this is where the location is of the rash, and I want to take an image. Now I've very handily got a picture of a Diet Coke can here, and we can use that image there. And now that image is completed. The other images should be optional. I didn't add some of those in. And I can submit that image, and that's completed and ready. So now that image has been completed, I can now integrate back into my clinical record, clinical system. I've got another button set up here, which is going to launch the in-healthcare application, log me in, and show me the images that are available. I can see the image that I just took. And I can say I want to upload that back into System 1. And that image has successfully gone back into my System 1 record. I can now see that that is available against the record in the patient's attachments. So as you can see, the power of the in-healthcare toolkit means that we've very quickly built a service on the toolkit, been able to deploy it, being able to test it, and be able to prove that very quickly and easily we can develop these proof of concepts with users. We can get them in the hands of patients, in the hands of healthcare professionals, testing out digital health services and getting that feedback. Because it's very important that we rapidly innovate and rapidly test out these digital innovations before we look at rolling them out at any pace and scale.